Good day, everyone. We are Group 6, so today we are going to report about social issues and problems of different sectors of the Philippine society, their situation, needs, issues, and struggle from a gender lens. And in this topic, we are going to discuss the informal settlers and persons with disability.
Good day everyone, I am Rejoy Lamson and I'm going to report about the Manila informal settlers face relocation in exchange for clean bay. So first, what is informal settlers? Informal settlers is a broad concept that refers to individuals in groups who establish their principal residence in mostly urban areas and types of dwellings considered illegal or in discord with the dominant social norms. So, informal settlers, mao ni sila ang nagpuyo sa areas which is not entitled sa ilaha. The Philippine government has started relocating over 200,000 families living beside rivers in order to rehabilitate Manila Bay, the main body of water in the capital. The relocation of informal settlers is part of 7-year plan to clean up Manila Bay, which is one of Metro Manila's most polluted bodies of water. Increased rainfall as a result of extreme weather occurrence poses a risk to area informal settlers, as it could result in landslides and flooding. So the government is posing the relocation in order to be safe by the informal settlers. So, if ever man jud nga mo kusog ang ulan, it will cause a landslide and flooding. So, delikado kaayo siya sa mga tao nga nagpuyo dito sa bay. So, one of the resident of the bay named Herla stated that they practice throwing their garbages in the bay because there is no one who collected their garbages because the area they live is considered as illegal settlements. So, she said that we throw our garbages in the water as well as our neighbors because it will go away when the tide comes. So, even their bathroom is just a small section of their living room, partitioned off with a blanket. The toilet is a hole in the floor. So, she said that she never gets sick in eating fish from the bay. Even the waste goes straight into the water. She also said that they harvest mussels, crabs, and fish like tilapia and more. So, kung kita siguro nagpuyo sa bay or kita ang naa sa ilahang part, makaingon ta nga, magkasakit man siguro kita kung ang atuang gikaon is from that water na didto ragi gilabay tanan waste nila like garbages and mga hugaw sa ilahang lawas. Then so magkuha sila og water para kaligo nila dito sa bay na ang bay baya kay dito ang ilahang mga waste garbages. So sa atua as a human being nga wala nagpuyo dito sa dagat nga gipuy-an nila, makaingon ta nga magkasakit jud ta. And also the food that they eat nga dito nila ginakuha nga, so example sa fish nga nagkaon sila tong fish na so nagikaon sa fish ang ilahang hugaw, so just like that. So it is very important for them to be it is very important to informal settlers nga mabalhin jud sila sa ilahang resident because dili sad maayo nga inana dili pa man nila mabatian ang sakit karon, but in the time will come, so luoy kaayo sad sila. Fighting climate change impacts. When it comes to relocating informal settlers, the base pollution isn't the government's only concern. There also climate change. Example, that already happened in Isla and nearby compounds in Tondo when Typhoon Kichana, or known as Bagyong Ondoy, hit Manila in 2009. So, ang government yun, gusto gid nila nga ang mga informal settlers is mabalhin og resident in order for them to be safe ang ilahang panginabuhi, safe sad sila nga magpuyo, and also the bay will not be dili na hugaw ang bay, then it will be attractive na sad siya kay sa giingon pa ato nga ang Manila Bay is one of the bodies of water sa kapital sa Luzon, which is the Manila.
Why are there informal settlers? Population growth, rural-urban migration, a lack of affordable housing, poor governance, particularly in policy, planning, and urban management, economic vulnerability and low-paid work, marginalization and displacement caused by conflict, natural disaster, and climate change have all contributed to the emergence of informal settlements. What is the impact of informal settlers in the environment? Furthermore, informal settlements are places where residents are exposed to daily health risks as a result of neighborhood effects such as inadequate sanitation, overcrowding, substandard housing, physical hazard, population, and poverty.
Good day, everyone. Today we're going to discuss amid a pandemic evictions plague the Philippines diploma. So, how can Filipino families, especially low income, stay at home when they are being forced into homeland? So, what is eviction and demolition? Demolition is a science and engineering in safety and efficiency, tearing down buildings and other artificial structures. Demolition contrasts with the deconstructions, which involve taking a building apart while carefully preserving valuable elements or use purpose. So from the word tearing down, iyag yung gubaon ng mga buildings, balay, or other infrastructure. Kabalo naman kita ning demolition. Kasagara ang demolition makita ni siya sa mga kaning squatter area nga kanang ipapahawa sila tapos hawanan dayon nila ang area. In this March 24, 2020 photo, a sign that prohibits non-residents from entering the area is hung at the entrance of the slum area as two men sit outside while the city goes on enhanced community quarantine to prevent the spread of the new coronavirus in Metro Manila, Philippines. So, atong March 24, 2020, atong mabasa din hinga, nagpahigayon og enhanced community quarantine ang Metro Manila, which is to prevent the spread of coronavirus. Pero pag makita na to din sa picture na ay duha ka badlon nga lalaki nga naggawas-gawas. As you can see, wala pa gali face mask. So mo nang hinungdan nga modaghan ang cases sa mga COVID-19. The state of calamity was recently extended by President Rodrigo Duterte for another year, until September 2021. Evictions in slum communities have been steadily increasing in the Philippines even as the country continues to enforce quarantine procedures. Last September 2021, ang state of calamity kay gipa tasan pa ni Presidente Rodrigo Duterte kay tungod sa pagdaghan sa kaso sa COVID-19. Bisan nagpadayon ng insecure or enhanced community quarantine, nagtaas gyapon ang kaso sa pag-demolish or eviction sa mga gadmay nga lugar diya sa Metro Manila. More recently, in early September, the Manila government issued a demolition order that would affect thousands of residents living in the state-owned housing in the Tondo area. So again, last September, nag-issue na po ang government nga mag-demolish sila sa area diya dapit sa Tondo. Pero sad to say, thousands ang maapektuhan tungod sa paghimo sa demolish. Manila Mayor Esco Moreno offered a spot in new condominium, but public housing is not always readily affordable. Atong mabasa dani nga nag-offer ang mayor sa Manila, which is si Mayor Esco Moreno, nga bag-ong nga puy-anan diya sa condominium. Pero kani nga balay dili ma-afford sa mga ingon nato nga mga ultimo ra kay mahal-mahal gyud ang presyo. Tolda also revealed that in September, the Presidential Commission for the Urban Poor or PCUP informed locals that they underwent a pre-demolition conference that would eventually lead to an eviction notice. No notice has so far been served, but in many cases, demolition teams and trucks accompanied by law enforcement often strike without warning. Nag-ingon si Tolda or also known as Jessa Tolda nga iyan ang gi-inform da ng mga locals nga maghimo sila og pre-demolition. Pero sad to say moabot gyapon siya sa eviction notice. Bisan og walay notice nga gihatag giabot ang mga demolition team which is ang tiguba sa mga slums without any warning. The National Urban Poor Group slammed the surge in demolitions being reported in the country and in Metro Manila especially. They noted that, aside from Tondo and Intramuros, 4 other communities in the city face evictions with more than 10,000 families being affected in total. Sa atong nabasahan, gipadayon gyapon nila ang paghimo sa demolition. Luoy ang mga 10,000 ka families kay naapektuhan sa gibuhat nga demolition dina sa Tondo, Maynila. One reason could be that the overall priority of the administration is neither public health nor social housing, but infrastructure. With economic woes piling up, the prospect of becoming homeless or even being forcibly uprooted amid a pandemic presents hazard many are understandably wary of. So atong masabtan din nga ang rason di ay kung anong gipademolish sa government ang mga slums kay ilang tukuran og infrastructure. Wala sila nag-worried about sa health, sa housing sa mga tao.
Good day everyone, I am Crisa Lorenzo. Today I am going to report about disability and poverty in the Philippines. But before tamo ato nga topic, let me tell you something. That did you know in the Philippines, mental health problems for those who are disabled have recently increased. As COVID-19 spread, disabled citizens living in the Philippines suffered from a lack of treatment, heightened health concern, and furthermore, inequalities increased as there was a lack of healthcare data to help inform and protect the disabled. So, let's go on to disability and poverty in the Philippines. But before that, let's define first what is disability. So, disability is any condition of the body or mind that makes it more difficult for the person with a condition to do certain and interact with the world around them. So, in Bisaya, ang disability kay katong mga tawo nga naay diferensya. For example, katong naputan og tiil og kamot. Second, let's define what is poverty. So, poverty is about not having enough money to meet basic needs including food, clothing, and shelter, which is, in Bisaya, kalisuron. Kanang maglisod na bitaw tag afford sa atong mga panginahanglanon isip isa ka tawo. Since atong topic kay disability o poverty, na ako'y pangutana, unsa day relationship sa disability sa poverty? So according sa article nga akong gibasa, ang disability o poverty kay connected lang siya sa each other. It is because disability is both a cause and consequence of poverty. So, when we talk about persons with disability, kabalo gyud nga na-discriminate yun na sila sa atong society. Pero aside sa discrimination, nag-face pa sila problem like poverty or kalisuron kay maglisod sila og meet sa ilang basic needs. For example, dili sila kapa-check up, dili sila kapalit sa mga medicine nga kinahanglanon. Lack of education, wala sila ka-eskwela tungod pud sa kalisod, og lack of financial kay kanang kasagaran mga disabled or person with disability, walay magdawat sa ilang nga work pero gladly na tagaan na gina sa government og way nga bisan disabled ka, maka-work ka. So, when we talk about lack of financial, ang government na sila gihatag nga financial support sa mga tao nga naay kapansanan diri sa Pilipinas, just like in Cebu City, with the government provided financial aid in the form of insurance, supplies, and resources in May 2021. So kay nag-COVID man, kanang ang mga person with disability naglisod gid sila. Just like in Cebu City, the government provided financial aid in form of income, supplies, and resources adtong May 2021. Essentials nga ilang gihatag just like wheelchairs, hearing aids, and medicine nga gihatag sa mga eligible people nga naay panginahanglanon. Tapos each household makadawat og 5,000 in monetary assistance covering January to May of 2021 and a period of time where no income was given. According to Selena Soto, government measures that disability legislation has aided the disabled in the Philippines for many years. The Magna Carta for Disabled Person Act was passed in the year 2007, allowing nga katong tanan disabled citizen makadawat og minimum 20% discount sa tindahan ug sa serbisyo. Unsa ni nga serbisyo? Dental, medical care, hotels, theater, and travel kay na-covered na ato. So, since persons with disability naka-encounter sila problem sa education, in regards to education, the disabled have the right to primary, secondary, and all higher levels of schooling with proper financial assistance provided. So, ginatagaan na gid sila. This comes in form of aid packages, a scholarship, full coverage, and book and supply financing. And also for those who are physically or mentally unable to work, na sila right to benefit gikan sa Social Security System or SSS and Government Service Insurance Systems or GSIS. In light of COVID-19 pandemic, according to Selena Soto, this ability aid is particularly relevant. Regarding disability and poverty in the Philippines, providing care and support for disabled citizens will make a major difference in success of the country. Strengthening the Mental Health Act is necessary also to improve the quality of life for those who are disabled. Recent improvements in medical support, therapy, and pandemic relief mark the beginning of helping those in need. And by that, I am also happy that our government is taking steps to help the disabled community in our country, which is the Philippines.
Good day everyone, I am Hani Joy B. Ligoro. For today's video, I am going to share with you guys my topic about managing the mental health of persons with disabilities amid the COVID-19 pandemic in the Philippines. What is mental health? Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community, according to the World Health Organization. So, basically, ito ay ang pag-iisip ng tamang desisyon para maisulba ang iyong mga problema na hinaharap sa araw-araw. And we usually use this line when we feel bad about the situation nga. Laban lang ta. And that is an example of taking good care of your mental health. The COVID-19 is overwhelmingly distressing people from all walks of life. According to Fargert et al., the economic shutdown and social isolation have most likely resulted in a complete transformation of the psychosocial environment. So they further claim that the current crisis has presented a challenging time and huge potential to impact the mental health of people. Studies on mental impact of mass disturbances, such as natural disasters and disease outbreaks, indicate that the current crisis particularly harm the mental health of marginalized population. These marginalized population include vulnerable segments like PWD. negative social perceptions toward PWDs. Despite numerous policies such as Executive Order Number 385 and Executive Number 261 that promote social awareness for PWDs in the country, stereotypes are still prevalent. For example, in a recent 2019 research, results revealed that there is a general hesitancy on the part of human resource officers, managers, and supervisors to employ PWDs. Some employers still see disabilities as obstructions for productive occupations. As mentioned earlier, PWDs receive financial aid through transfer income. However, they are still way behind suitable employment and accessible health services particular to PWDs. The health welfare of the PWDs in the country is covered in the laws such as Republic Act No. 1128, which mandates specific health and development needs, services, and rehabilitation, and the Republic Act No. 10754 on the discount on essential medical services such as medicine. PWDs can avail of the health services through sponsored health access for PWDs, which may further worsen amid the pandemic. Key actions to manage the mental health of PWDs. Number 1. Since existing negative stereotypes may highly reproduce biases against PWDs in the different aspects of life amid the COVID-19 pandemic, possible biases preventing access based on disability, especially on the level of care, support, and employment should be monitored. Number 2. The different stakeholders are strongly encouraged to take key action by consulting with representative organizations to frame multi-sectoral mental health responses for PWDs. Number 3. Another key action to the highest attainable standard of mental health is sustainability. 4. Several scholarly works have been published to assess the mental health of Filipinos amid the pandemic. Number 5. There is a need to include in the national census the particular types of disabilities of PWDs, especially those with intellectual and developmental disabilities. A closer look at the specific factors can lead to the formulation of key actions to manage the mental health of PWDs amid the current COVID-19 crisis. This short report discussed the specific factors and key actions in managing the mental health of PWDs amid the COVID-19 pandemic in the developing country of the Philippines.
And that's all. Thank you.